Hi, my name is Sanjana Boyapalli, and I'm a research coordinator here at the Johns Hopkins Department of Pediatric Nephrology. The study that we presented at the Pediatric Academic Societies Conference is the association of socioeconomic status and cardiovascular disease risk factors in youth. There is a lot of existing literature that indicates that childhood socioeconomic status, or SES, is related to cardiovascular disease risk in adulthood, which makes sense because cardiovascular diseases tend to be chronic illnesses that develop over time. However, there's not much research on whether disease risk is already elevated in childhood itself with respect to socioeconomic status. It's important that we understand this so that we can develop and employ proactive measures more strategically earlier in life to prevent or slow down chronic disease progression. So my team and I looked at the independent association of neighborhood SES with blood pressure variability, and arterial stiffness in youth. The SES metric that we used was the Area Deprivation Index, or ADI, which is based on census data related to the patient's residential address, and high ADI indicates higher deprivation and thus lower SES. Ultimately, of the 78 children whose data we analyzed, we found no differences in arterial stiffness between groups. However, after adjusting for both age and sex, low SES and high ADI were associated with increased systolic blood pressure variability, and high ADI was associated with the manual systolic blood pressure index. Interestingly, these relationships lost their significance after adjusting for obesity, which may indicate that obesity prevention and treatment measures are still effective interventions in these populations and are something we should explore further. Thanks so much for watching.